The death toll from the Wuhan virus had climbed to 132 in China, with 25 reported overnight, and almost 6,000 cases have been confirmed, surpassing the 2003 SARS epidemic in China. Meanwhile, the virus continues its spread across Asia and the rest of the world. Taiwan, Vietnam and Germany have reported infections caused by human-to-human transmission. A top respiratory diseases expert in China said the outbreak had yet to reach its peak and that he expected it to do so within a week to 10 days. However, Hong Kong academics predicted infections will only peak months later, around May. We have China correspondent Elizabeth Law to give us the latest updates. Now, Liz just returned from China last week and is currently working from home just to be on the safe side. Hi, Liz.
Hi, Jan.
Hi, Liz. Welcome. Now, it seems, Liz, that the spread of the virus is not slowing down, already outnumbering the number of people infected by SARS in China now, and of course, another 25 that was dead overnight. How are the people coping there?
Well, so earlier this morning, I spoke to some people from Wuhan who were saying that basically what is like in the city is that it's pretty much become a ghost town. But I think one challenge is also how to keep yourself being positive, to be upbeat, because it is quite difficult being cooped up in an apartment for extended period. I mean, I know I've been here since I got back from Beijing last week. So basically, we have seen some online videos of people shouting out of their windows at night, saying that, is there anyone there? I'm bored, I want to get into an argument with someone. And also this lady that I spoke to, Scarlett, she says that what she's done is that she's been going online more than usual. She's actually paid premium subscription for all of the video streaming services, and also basically she says she's never read these many books ever. But of course, there are some people who are also quite worried, like this photographer I spoke to. He has a pregnant wife who is due next month, and they are a little bit concerned about when she's going to deliver the baby, whether or not the hospital would be safe, and they're looking at going to a hospital slightly further away from where they live in Wuhan, in hopes that maybe it would be slightly safer. But of course, one last thing is that the challenge is because earlier I saw that you guys spoke to someone here in Singapore who said that this older lady who said that, I don't wear a mask because I'm not used to it. And basically, this is the exact same challenge that people in Wuhan are facing. The older folk, they don't quite believe how serious this can be, and they're like, why should I be wearing a mask? Because it's really uncomfortable, And so that is one of the challenges that they're facing. But they are trying to. Obviously, it's become so serious that people are now getting an idea that, okay, I need to wear a mask even though it's uncomfortable, but because if not, I'm going to die.
Yeah. Now, Liz, it does sound quite serious there. And as the number of infections increase outside of Wuhan, is there a growing sense of resentment within China against people from Wuhan?
Well, I think quite significantly there is, because earlier today at a press conference, I'm just going to call this up on my screen. Earlier today at a press conference, hosted by the National Health Commission, one of the officials actually said that we have to make clear that our common enemy is the disease and virus, not the Wuhan people. So, I mean, the fact that a senior government official has to say this, I think it really shows how the tide is turning. Of course, it is not to a scale where people are really mean and terrible to people from Wuhan or being discriminatory, but I think the government also wants to try and nip this in the bud before it escalates and gets too much. I mean, some quarters of the internet we have seen already people posting stuff saying that let's just all ban people from Wuhan, let's stop people from Wuhan from coming out forever. I mean, in normal situations, people on the internet can be very, very terrible, and I suppose when you've been cooped up at home for the better part of about 10 days, it just makes that a lot worse.
And Liz, of course, what are the Chinese authorities doing now? Are they doing anything else more to help the situation?
So basically, we have seen there have been travel restrictions in quite a lot of places. They are doing the best that they can. They are trying to increase, like make sure that supplies of provisions and all sorts of things are sufficient for for people. There are safeguards in place. Whether or not they can do more. I mean, they already are doing the best that they can, and WHO has also said that they are going to send in experts to China to help. I think one of the things is that the very big concern is that a super spreader might emerge. They've said that there hasn't been a super spreader that has emerged yet, but we already know of at least one case where a man infected 14 medical workers. So that is something that is quite concerning, because we all do know that SARS actually spread quite quickly and very widely because of these so-called super spreaders. Basically, one person that can actually spread to quite a lot of people. So I think that is one of the biggest concerns now, and also I suppose it's really about trying to manage the movement of people, because now that the Spring Festival holidays are almost over, people are going to be going back into the cities from the rural areas, and there are worries that this may lead to yet another spike. So that is something that we will have to wait and see.
Well, thank you so much, Liz, for the updates. Certainly, we are looking forward to you returning to the office. Now, the wildlife trade in China has been put under the spotlight recently, and Chinese authorities have temporarily banned the trade of wild animals following the virus outbreak. In the latest episode of Asian Insider, host Nimal Ghosh speaks to a zoonotic disease expert and a wildlife crime expert about the risk of disease from the wildlife and exotic pet trades. So here are the highlights.
So, Dr. Tajak, the issue of zoonotic diseases crossing from animal species to humans, has been a major concern in the scientific and public health communities, but it's not really top of mind in the general public. Do you think it will be different this time around? Do you think this issue will get it the attention it deserves across the board?
Well, I really hope so, actually. I mean, we seem to, every time a new disease has emerged, we all seem to say, wow, that disease came from nowhere. We didn't expect it. Yet, to those of us working on what drives this, it's absolutely predictable. We're going to see more and more of these as we do more things to the environment around the world, as more people are on the planet, and more people are doing things like hunting and eating wildlife. These are high-risk activities. And I think we really need to get to the underlying causes of this.
So now we hear that China has imposed a temporary ban on wildlife in markets. Justin, this has happened before, this kind of temporary ban, after SARS, for instance. But bans are useless without enforcement. And China is the focus now of this outbreak, but other countries could be next. What are your expectations of this?
Absolutely. We've seen bans before for these kind of diseases. Then they've been relaxed again. So we've gone back to business as usual, and look what happens. So many people are welcoming this temporary ban and asking for it to be made permanent. But one of the things that we haven't really focused on is how that ban is going to be forced. Now, the language that was used by the Chinese government is quite robust in the sound of it, but we need to see tangible enforcement. And one of the reasons we have this problem with this particular disease is a lack of enforcement against the illegal wildlife trade, not just in China, but globally. It's a woefully inadequate response to the illegal wildlife trade. So unless we have enforcement of that ban, it's likely to be largely ineffective.
What are your expectations of China's temporary ban on illegal wildlife in markets?
Well, first of all, we're absolutely delighted that China's put a temporary ban on wildlife in markets. However, that's exactly what happened in the SARS outbreak. And, we tracked the trade in wildlife in southern China since SARS. Our goal was to go to the wildlife markets where SARS emerged and to trace the trade in wildlife to see where the virus came from. And what we found after SARS was the wildlife trade was open again. China had loosened the regulations, but a lot of wildlife just weren't there in markets. And we saw a shift in the way people were trading wildlife. Hunters were supplying to middlemen who were then supplying directly to restaurants. So I would call in perhaps on Tuesday and say, I'm bringing some business friends over for dinner on Friday. Can you supply me with some crocodile meat, some bats, some civets? It's a special meal with great cultural significance. And then the restaurant owner would get in touch with middlemen who would supply them live animals butchered on site. So the trade is still there. It's harder to track, and people are more wary in talking about it. China has tried its best, I think, or it's tried a lot to deal with this. But what we're dealing with in China and in Southeast Asia and throughout the world are thousands of years of cultural significance to the food animals that are eaten from wildlife. And I think breaking that is going to be harder than just simple banning. We need education programs about the health risks. We need to use the health impact of wildlife trade to try and put people off eating and trading in animals. We've started to do that. We've surveyed people in China and found that older generations are the ones that eat wildlife. The younger generations are less interested. We should be using that to push this agenda and to help people across the world realize that this is unhealthy for them and unhealthy for our planet.
For the full video, you can check it out on the Straits Times YouTube page. Also, do visit straitstimes.com for the latest on the Wuhan virus.